Good afternoon, everyone. My name is Tamara Finn, and I wanted to welcome you all to today's webinar, and we will be going over the CMS ACO REACH Advanced Alternative Payment Model opportunity. And we all love our acronyms within healthcare. REACH stands for Realizing Equity, Access, and Community Health. And my presenter here, Carrie Lanham, will be going over the program for you. And as Ching mentioned, any questions, please put those in the chat area. Next slide, please. And then here we have our disclaimer. The target audience of this presentation is primary care physicians, physician's assistants, and nurse practitioners who serve Medicare Part B beneficiaries, but some references will be made related to hospitals and healthcare systems. This webinar is based on official guidance provided by Centers for Medicare and Medicaid Services and experiences from Blue Agilus and Clover Health. This presentation was prepared as a tool to provide information to providers who are interested in participating in a primary care advanced alternative payment model. This webinar is for informational purposes only and does not guarantee contracts or agreements. Medicare policy does change frequently. It is highly recommended to review any rules and regulations. The focus of this presentation is the CMS Advanced Alternative Payment Model offered through Clover Health Partners, which is the ACO REACH entity. Next slide. And then, as I mentioned, we do love our acronyms. So we do have an acronym page here. So we're going to utilize these acronyms. We will be sending the slides to everyone, as well as a link to the recording, so you can review that afterwards. Next slide. Take it away, Carrie.
Thank you, Tamara. Welcome, everyone. Our agenda for today is to give benefits of the participation in the ACO REACH AAPM opportunity. We're going to explain the Clover Health Assistant tool that is part of the program. And we are going to review program timeline and discuss next steps if you are interested in signing up for this opportunity. And after discussing, this program and talking with many practices, we have put together a list of frequently asked questions that we will review at the end of the presentation as well. So a little background about this program, considering stakeholder feedback as well as lessons learned from previous payment models, CMS has made some changes to their direct contracting program, of which one is the name. The new name of this opportunity is ACO REACH. And like Tamara had indicated, it stands for Accountable Care Organization, Realizing Equity, Access, and Community Health. CMS wants to work with partners who share their vision and values for improving patient care. The goals of the redesigned ACO REACH model are to improve quality of care and care coordination for patients in traditional Medicare, especially for patients in underserved communities. The CMS Innovation Center launched its first direct contracting models in April of 2021. CMS wanted to expand the types of organizations that were eligible for the direct contracting program. Clover Health was selected as one of the direct contracting entities for the Advanced Alternative Payment Model for primary care. As previously mentioned, CMS has changed the direct contracting model to ACO REACH. And the goals of the ACO REACH are to improve the quality of care, coordination of care, to also provide tools and resources to empower doctors and other healthcare providers to achieve these goals, and to offer greater individualized attention for patients while preserving the choice of providers. I have included a link at the bottom of this slide for a fact sheet CMS provided on ACO REACH if you would like to read more about this program. So there are a lot of benefit enhancements that are part of ACO REACH, and here are just a couple that we are really excited about with this program. First of all, from the patient perspective, the patient copay is waived for chronic care management services. So if you've tried to implement chronic care management visits in your practice before, you may have realized that there is a patient copay that's associated with those, and that sometimes was a barrier for patients. So that copay has been removed. So that is very exciting. Hopefully that would get more people to sign up for those visits. And on the provider side, there are incentives for engaging in chronic care management visits. The ACO REACH program is going to measure health equity so we can move toward a more equitable health system. There is also a telehealth benefit enhancement, which we know, especially during the pandemic and even now, how important it is to continue to offer telehealth services to our patients. And there are going to be more opportunities for underserved populations to have better coordinated care. So continue to talk about the benefits and why should you participate in this ACO REACH program? Well, providers can earn at least 30% more revenue per visit on their Part B Medicare fee-for-service beneficiaries, 30% plus depending on the size of your organization, 30% plus up to $5 per beneficiary per month, or 45% without the per beneficiary per month incentive payment. That is a no risk option, but we do offer upside and downside shared savings options as well. And Clover Health is considered a QP or qualifying APM participant. So providers in this program are eligible for the 5% AAPM bonus. Some additional benefits of participation in this program are there is a quicker and more predictable reimbursement turnaround. Additional revenue is paid quicker than the traditional shared savings programs. So if you currently participate or have participated in, for example, an MSSP, you know that those shared, and you did realize shared savings, they come about a year and a half later after, the reporting period, while these incentive payments are paid with the claim. So that is something that our current participants really appreciate. There is reduced data reporting. Everybody can appreciate that, I think. The current participants are excluded from MIPS reporting, and there is no quality measure reporting required by provider or practice at that level. Improved coding. Participation in this program can support more accurate and compliant HCC risk coding. If you're unfamiliar with that, it stands for hierarchical condition coding. It's a sorting mechanism for chronic conditions that assigns a risk adjustment value on the care of a patient with that condition. And if the HCC aligned chronic conditions are documented properly, which this program assists with, CMS may be able to reimburse even more additional dollars based on the risk adjusted values. So the more complex or complicated your patient is, there may be additional payment available for that. Another unique aspect of this program is that you get assigned a quality improvement advisor to support your practice in setting up and implementing the Clover Health program, and training to educate staff and providers, as well as support throughout the program. So this is something our current participants really appreciate as well, having that, initial support to set up the program, as well as support throughout the program to help them continue to be successful. So this is the Clover Assistant, and this is part of the program. It is a web-based application powered by clinical and claims data on Medicare beneficiaries. And it actually gives you 3 years of Medicare claims data. And something that is so amazing about this is that it's not only giving you the 3 years of Medicare claims data, but it's giving you that data at the point of care, which at least I have not seen another product like this that is giving you that information at the point of care. So when you're seeing the patient, you're able to see that information and make a better decision about their care. So you have the full picture, which is really can be very valuable. It gives you a comprehensive view populated with data from anywhere aligned beneficiaries have received care. So you might go into a patient visit, and on the right-hand side, it will show you, hey, this patient has seen, this doctor, maybe it's another specialist, or it could even be another primary care provider that you might not have been aware of. And it tells you what diagnosis that they were seen for as well. Using the Clover Assistant is a 3-step process. It's pretty straightforward. Before the visit, you queue up the Part B beneficiaries to be seen by the provider that day. During the visit, you use the Clover Assistant tool to complete the visit questionnaire. And after the visit, you just ensure that all applicable questions are answered and you submit the visit for payment. Visit completion usually takes about 60 to 90 seconds and gets quicker the more you use the tool. So, for example, the first time you see your Medicare patient in the year, you may have to confirm their diagnoses, and that's what this screenshot is showing here. You can see different chronic disease diagnosis that this patient has, and the ones with the yellow asterisks are the ones that need to be confirmed for that patient. But if you confirm the diagnosis, when they come back again in the same year, the tool will remember that information from last time, and there will be nothing to confirm, unless, of course, they had received new care for a new diagnosis somewhere else since their last visit. So that's how it becomes a lot quicker, the more that you use it. So switching gears back to our participation options, this program does offer 3 different participation options. And this presentation has been focusing on the first option of the 30% increase for fee-for-service Medicare beneficiaries. And a lot of practices like that because there is no risk involved. And if it's, they're newly participating in a value-based agreement, they may be, interested in that. But if you are interested in participating in a shared savings program, we do offer 2 additional options with no downside risk and with downside risk. And for more information about options 2 and 3, we will give you our contact information at the end of the presentation that you can reach out to us if you are interested in these options. So who is eligible for this program? The focus is any primary care provider, physicians, NPs, PAs. It also includes providers working at FQHCs or RHCs, and I wanted to put this in there because we have had some of these types of clinics reach out to us and are currently participating, and at first they didn't think because of their special, status of a federally qualified health center or rural health center that they were eligible for this program. But I wanted to let you know that you are. If you do have that status, you can still participate in this program as well. This is a national program, so providers can be practicing in any state and participate. Providers sign up by NPI, so not all providers in a group or working under the same tax ID have to sign up. And I think this might have been asked in the question box that Ching mentioned earlier, but you can be current ACO MSSP participants but you would have to stop participation in your current ACO or MSSP starting with our reporting period of January 1st, 2023. So, I mean, if you were participating in another program and you didn't really like it, or you didn't realize the shared savings that you thought you would, you know, this program might be a great consideration for you. This table shows a comparison of program characteristics between the Clover Health AAPM, traditional shared savings, and MIPS only participation. So you can look at how they compare on what you have to do for quality measures, what risk is involved, different payment incentives, support that is provided for the program as well. So like I said, we'll be sharing these slides so you can reference these differences as well and sort of compare your options. And this table shows an example of potential revenue that can be earned participating in the Clover AAPM, assuming your Medicare fee-for-service patients have 4 visits a year. You know, you may think, oh, an extra, 30% or 45% per visit, but when you add it up with all your beneficiaries and then the visits, it can really make a difference in your revenue earned for these patients. Partnering with Clover Health also gives you insight into your data. We have reports that you have access to that show your progress on using the tool, so you have feedback. Other reports show important information about your patient regarding readmissions, ER utilization, and how your performance compares to other providers in the ACO REACH program. These reports do include the Medicare claims data, allowing you to see the complete picture of your patients and your patient population. Lastly, I wanted to give you some important dates. The deadline to sign up for this program is coming up on July 15th, so just in a couple weeks here. So even if you're a little bit interested or have more questions, I really encourage you to send us an email, contact us right away, so we can make sure that you will get a spot for this program. The performance year starts January 1st, 2023, and it is renewed every year up to 4 years. So if you are interested in having more of a conversation about how this could help your practice or have additional questions, the next steps would be, like I said, we'll have our contact information at the end of this presentation. You can contact us, let us know you're interested. After that, you have to sign the ACO REACH agreement with Clover Health. And then we will begin to work with you to set up an implementation plan before the performance period begins January 1st. So you are ready to go when that starts. Again, I did want to reiterate that participation is limited for this program. So if you are interested, please let us know so we can ensure we save a spot for you. And next, Tamara is going to walk us through some frequently asked questions about this program.
Thank you, Carrie. So the first question that we have here is there a minimum number of beneficiaries a clinician must have to participate? And that answer is no, but it has been found to truly benefit from participation and see a return on investment with a minimum number of 100 beneficiaries. Next slide. Do Medicare beneficiaries enrolled under Medicare Advantage plans, such as Humana, count under this program? And that is no. This is for only Medicare fee-for-service Part B beneficiaries included for the program. Next slide. Can a delegate of the clinician complete the Clover Assistant review? The provider must review the clinical information, but a delegate can submit the visit after the clinician has assessed the information. Next slide. Does the Clover Assistant tool integrate with my EHR? Clover Health is currently in the process of integrating with some EHRs. If this option is available with your EHR, Clover Health will work directly with you to implement this. Next slide. Is the 5% AAPM bonus based off total Medicare billing for the practice or just office visit revenue? And the answer is the 5% AAPM bonus is based off of your total Medicare billing. Next slide. And now we have come to any additional questions that we haven't gone over and our contact information. You can contact either myself, Tamara Finn, or Carrie Lanham at the addresses listed there. So I thank you very much for attending. And as we said, we will be sending the slides and a link to the recording if there was anything that you wanted to go over that you missed, or certainly let us know your interest. Thank you.
And Ching, were there any questions in the chat that we wanted to address now, or we could?
Yeah, there were a couple of questions. I think we did, Sadia, address your question about interfacing with the EMR. If you want to give us your specific EMR, we can, look into that for you. So for Dean, your question was, is Clover Health servicing the AAPM benefits in all of the US, or are there similar Clover Health companies serving other states?
I'm not sure I quite understand that question, but it is a national program. So Clover Health is, we are, obviously we are located Illinois, Indiana, more of the Midwest area. And that is where, but it is a national program that anyone can participate in through Clover Health. If I didn't answer that correctly, please email me and let me know, and we can have a further discussion.
Suzanne, your question was, if you are already covered in Clover, is there another sign up for ACO REACH?
Yes, and Dr. Martini, this we will be discussing the the continuation of this program for you, and there is a new document to sign. But yes, moving forward into 2023, this is the program.
So Sadia and Katharina, they asked about eClinicalWorks and Epic for interface.
There currently is some integration for both of those EMRs. And depending on your setup for Epic, there may be an option for full integration. And I think that there is some integration for eClinicalWorks, and they're actively working on full integration.
Yes, and just let me add, for those EHRs, the integration is more of a single sign-on to the Clover Assistant tool. So it's more of a bridge information, just so you don't have to sign in to another area for Clover Assistant.
Great. Well, I think those are all the questions that I see right now. As Carrie and Tamara have mentioned, if anything comes up, please feel free to reach out to them via email. The email is listed here on the screen, and we will also be sharing the slides, so you will have that in your email.
Thank you, everyone.